Welcome back to Your Road to Home, your guide to Carbon Valley and the people that make our community so great. I'm Kendra Badgekar with LPT Realty, here with
Maxine Carey at Vector Bank, and we have Rainer with Wozani Integrative Health with us.
Hi, nice to meet you.
So Rainer, you are not new to the community, but
No.
new to the integrated health. Sort of, how did that journey begin for you?
New to owning my own practice.
Okay.
Yeah. So I've been in medicine for, it makes me feel a little old. I've been in medicine for almost 20 years.
Oh, wow.
So long time ago, started very much in like the emergency medicine, critical care field, working on the ambulance, then moving into the emergency department, and have kind of just like adapted and grown through that time. So started as an EMT, like at 18, like as soon as I could get my license, I got it.
That's awesome.
And then worked in the emergency room as a nurse for almost 8 years. And I mean, in that time frame, I really saw that yes, every once in a while we did do like emergencies, right? And we were able to like care for those patients. But the majority of what we did in the ER was just like managing unmanaged chronic diseases, right? So that really kind of changed my perspective on healthcare, and me always kind of wanting to like make more of a difference. I kind of decided to go back to school and get my nurse practitioner. And at that time I was like, family practice was really kind of the place where I was like, this is where I'm going to make that difference. Right. And I was like, cause in the ER, I'm seeing all the effects of like poorly managed chronic diseases and all of the, like the effects of that. And so I was like, I'm going to make a difference in primary care and doing family practice and kind of move a little bit upstream and kind of try to fix or address issues there. So I did community health. I'm not sure if you guys are familiar with community health. So really kind of like the low income, underserved communities. I did that for almost 2 years. And I did a lot of my my residency during school in community health as well. Loved working with that that community, but when I kind of like got working in that space in that field, like I quickly realized that like what I really wanted to do in kind of like education and counseling and because really when we talk about chronic diseases, it's all about diet and lifestyle. A lot of it comes down to that. There are some other factors at play, but a lot of it is diet and lifestyle, and that like there's not quick fixes to that. And when I was working in community health, like quickly realized like why I saw what I saw when I was in the ER, because in a 15-minute appointment you don't have time to do good care and give that education and ask those questions and answer questions that the patients have to like make effective change. You have time to prescribe a medication and have them follow up in a couple weeks. Right.
So you're drilling down with those appointments. Like you don't have 15-minute appointments. You have hour appointments, right?
Yeah. So that was, and so I realized, and as throughout this time, like I was kind of getting more and more drawn to like that integrative functional medicine care model, where in functional medicine is essentially like root cause medicine, right? We're bringing in like allopathic medicine, which is Western medicine, as well as like other like healthcare modalities like chiropractics and like acupuncture and nutrition, and kind of bringing that all together to care for the patient, right? But I realized that if I wanted to do it the right way, there's not a lot of practices that do that, and so I realized I had to do it myself.
Right.
And that's kind of what drove me into opening up Wozani Integrative Health. So, but yes, to your point, like all of my new patient visits are an hour. sometimes we don't use the whole hour. Most of the time we do, but it gives that time and that space to get a good history, ask and answer questions, right? And do a good exam and just a good intake, and kind of check in like a good kind of starting point of that like patient provider relationship. So
love that. Where does the name Wozani come from?
Yeah, so before Wozani Integrative Health, there was and there still is Wozani Farm here in Frederick. My wife and I started that. We moved there in 2018.
Okay.
And initially, we just really wanted to teach our kids where like food comes from, right? And kind of get back to the basics of like, this is where real food comes from.
I love that.
But my wife, she's from South Africa, and there's a word in both the Zulu and Xhosa languages called Woza or Wozani, which means to come or to gather. So when we got the farm, we really had a vision of it being kind of like a place of community and people coming together, and kind of that feeling for the farm, and so that's where the name Wozani Farm came from.
That's
so
awesome.
when it came to opening up my practice, and currently my offices are on the farm.
Okay.
We're growing though, so that's we won't be on the farm long term.
Very cool.
Wait for that.
Yeah.
Yeah.
To be disclosed in a couple of months, right?
Yes. But so yeah, it kind of made sense to Wozani Farm became Wozani Integrative Health came out of that.
Love that.
So
Very cool.
yeah,
That's exciting. So growing quickly. So when did you go off on your own to start your own practice? How long have you been doing this?
so I started it. I officially opened it in November of 2023.
Okay.
So we're coming up on 2 years.
Very cool.
And I was really just kind of doing it. I'm a very cautious person, I'm sure. my wife would attest to that. So the whole idea of like, just like, we're starting a practice and I'm like quitting my job, like that was very not me.
Yeah.
So I started doing it very like part-time. It was a very, I was seeing patients on the days that I wasn't in clinic.
Gotcha.
It started very kind of organically. I was doing a lot of home visits, and I still do home visits on occasion. But I don't know. I like that old town family doctor feel.
Yeah.
Right.
Yeah.
Where,
that's awesome.
everybody in the community knows me, and I know them, and I get to see all those families kind of like grow up. But yeah, kind of started part-time and continued to grow it, and just by word of mouth, because I'm really bad at social media, very bad at social media. I was not doing very much advertising, so it was, but by word of mouth, just continued to grow.
Very cool.
And October of last year, I had a very hard decision to make. I was like, I cannot work 2 full-time jobs.
Right.
What am I going to do? And I mean, this is what I've always wanted to do. So it was a big step, but it was a pretty easy decision to make.
That's awesome.
So how did you make that decision? Because there's probably lots of entrepreneurs out there who are juggling 2 full-time jobs or a full-time job and a part-time job. Like, obviously you and Liz sat down and kind of made those.
Yeah.
Did your pros and cons list.
We did the pros and cons, and there was a couple other things that kind of accumulated with that. So Liz and I had been praying about it for quite a while about like, give me a sign, like what is, and there were just some things happening at my other job that I just did not agree with, and like we were kind of butting heads with the medical director, and so that in addition to just already working, having basically another full-time job,
right.
Was like, all right, well, this is it. Like, well, we're gonna do it. So yeah, that's kind of how it happened. it was not a cut and dry.
Right.
It was just kind
I'm
of
sure it
like,
never is, right? But there's always financial in there. Like,
Yeah.
what's that impact?
Yeah.
What's the
yeah.
impact to the family? You probably now have more time with your family. You have 4
Yeah.
kids.
Yep, 4 kids. 4 kids under the age of 10. So
Yeah.
it's
So that's not difficult.
no.
That's easy.
2 businesses between my wife and I,
Right.
and a young family. Yeah, it's a lot, but that was a big reason why, because now we're both home, right? I have my commute is literally walking across the farm to my office building, and being able to be home and make my own schedule so I can be off for kids kids events. So
For sure.
So are you open 5 days a week? Your office hours?
Yes.
Okay.
I took Wednesdays off at the beginning of the year, during the beginning of summer, just to have a little bit more time with the family. But starting at the end of this month, I just brought on another provider. He's going to be starting part time, and then moving full time when we have more space. So
Very cool.
and we have more than one office.
You're teasing. There's so many
I
teasers
know,
here.
I know.
You think?
That's
yeah.
so great.
Yeah. So yes. So back at the starting June 25th, at the end of this month, we'll be back to seeing patients 5 days a week.
Very cool.
So,
Very good. Congratulations
but
on that.
thank you. Yeah. But as I'm sure anyone that's ever worked family practice can tell you, we have office hours 5 days a week, but we're really working every day of the week.
Oh yeah. Yeah.
So it's because that was another thing. I want to do good medicine, and that's what led me into the functional medicine side of things. But I also just want to do good primary care. I hear it all the time of there's the frustration with patients, and when I was in the ER, of oh well, we tried to get into our primary care and they couldn't see us for 3 weeks.
Right.
I don't think that's right. Primary care is should be everybody's first stop.
Right.
Right. Because a lot of things can be handled in office or and not in urgent care in the ER. But everyone kind of gets pushed to the urgent care in ER because they just can't get into their primary care.
Right.
And so my other goal with this practice was just to do good primary care. So I make a point of getting patients in same day or next day.
That's awesome.
And sometimes it's I've seen patients and done stitches at 7:00 at night. So I all of my patients have my cell phone number.
Wow.
And they don't you would a lot of people are oh, you give your cell phone number out, and I'm yeah, and it doesn't get abused.
That's good.
So
That's amazing.
That's really good.
Do you do pediatric care too, primary care for?
Yep. So I do
kids?
full family practice from birth, the full life spectrum. So
Okay.
my oldest patient is about to turn 99.
Wow, that's
So,
amazing.
Yeah. And my young, I see newborns every week. So,
You do.
Yeah.
Okay.
Yeah.
Very cool. That's
So-
good to know.
Yeah.
Well, then people are going towards that functional integrative medicine. They
Yeah.
would.
I
They really
think-
kind of want to figure out how to.
Over the last couple of years, I feel the people's perspective on what health is and what that health means to them has definitely changed, and there's been a lot of self-education, which is great. I'm a big advocate for patients being their own advocate, and if you have questions, sure, bring your Google Chat GPT your symptoms and bring in your questions, and we'll go over that together. But I want you to advocate. I encourage all my patients to advocate for themselves in that way. And I think through that, a lot of people have just learned that health isn't just taking a prescription. That's a Band-Aid, right?
Right.
In a conference several years ago, one of the speakers had said that it was kind of eye-opening, and it kind of changed my whole perspective on pharmaceuticals. I'm not against pharmaceuticals. I use them. I prescribe.
Yeah.
I still prescribe medications when it's indicated. But if you think about, there's only really 2 classes of medications that cure disease. And when I say classes, like groups of medications, like, and those two classes of medications are antibiotics and chemotherapy.
Wow.
Everything else just manages a symptom or manages a disease, but it doesn't cure it.
Wow, that's very eye-opening when you put it into that perspective.
Right?
Wow.
So, like, really, when we want to, like...
Well, and when you go to the pharmacy, you get your leaflet that you're like, whoop.
Yeah.
Yeah.
Who reads that?
Right.
Yeah,
You know, you might read like a paragraph. What are the, you know,
Right.
Yeah.
but
But
you
if
know,
we're really, like, seeking and, like, trying to get to, like, optimal health and, like, optimal wellness, like, that's when we really need to dive into the root cause, right? Go farther upstream. A lot of times, like, Western medicine tends to silo a lot of problems. So you have high blood pressure, and you have diabetes, and you have high cholesterol, right?
Right.
And we're going to treat them all separately, and they're all separate entities that need to be managed. But if you start to take those and kind of move upstream, you start to realize how they all start to converge, and they're all connected.
Sure.
Right. So that's really kind of the root of functional medicine, is like going farther upstream, finding like that diet or lifestyle like factor that's contributing to it, or nutritional deficiency, and addressing that. I always tell patients, I'm like, don't worry, I am not going to let you walk out of here with a blood pressure of 190 over 110 and tell you to go like increase your exercise
Right.
and take magnesium, right?
Yeah,
Those
yeah.
are both going to help,
Right.
but we're going to reduce that risk now.
Yes.
I'm going to put you on a blood pressure medication.
Yes.
We're going to work on some of those upstream problems with the goal of taking you off of that medication in the future.
Love that.
Right.
Yep.
So anytime I prescribe a medication, I always tell patients, I'm already planning on how to get you off of it.
That's awesome.
So, and sometimes, I mean, sometimes there's cases where like we do need to have somebody on a medication longer term.
Sure.
That's, but it's, I don't feel like it's a one size fits all type issue. So
Yeah.
everybody's situation and their history is all a little bit different, and so being able to like personalize that care is really important.
Love that.
so if someone was on a prescription and came off of it,
Uh-huh.
like years down the road, could they still be dealing with effects of taking that prescription? Like, is that a thing?
Depends upon the prescription.
Okay.
Yeah, it depends upon the medication. It's possible.
So really, if people are coming in to see you, they really should go through their history for a couple of years so that, you know, like remember what you've taken 2 years ago. Is that helpful or is that not helpful?
yeah, so
Or you just want to know immediate?
that's what I love about like functional medicine is it's not just like, all right, what's your chief complaint today? Let's deal with it. We're really kind of looking back. The functional medicine in our training, like through like when I did my functional medicine training, like that we have what we call like the matrix and the timeline, and so we go back, like, all right, were you a vaginal or were you a C-section birth, right?
Oh.
We go all the way back, and we kind of look at all of those antecedents, triggers, mediators, and kind of see like what's contributing to this like picture of where you're at now, because that's important.
Yeah, that's amazing.
It all gets tied in. So, and it's important to kind of look at that whole picture, because you'd be surprised at like what you find out when you start digging a little bit more.
I bet,
And
yeah.
what people don't realize about themselves.
Right. That they've just forgotten about. Yeah.
Yeah.
Very
Yeah.
cool. Do you accept insurances?
Yeah, so I'm actually in network with Intake, Medicaid, Medicare, Blue Cross, Aetna, United. Just signed the contract with Cigna last week.
Awesome.
So should have an effective date with that here shortly, and TRICARE as well. So that was really important to me. I wanted to not create just good care, but also accessible care. I know.
And that's huge for people because most integrative functional medicines don't take insurance.
I think I am the only one in north of Denver that does take insurance. Yeah.
Okay.
So I have a couple options. I do like the direct primary care and like cash pay services, but I'd say like 85% of my patients use their insurance. It was a lot of people ask me why I chose to like deal with the headache of insurance, and I was like, and the answer is easy, is like, I have insurance and
you want to use
Right.
it.
I want to use it, so
Yeah.
I can't expect my patients to
Yeah.
do something different.
Totally.
So
Love that.
that was it was kind of an easy decision for me.
Well, that's a lot of work. Signing up. I
It
know that.
is, yeah, and especially when I was first getting started, I was doing all of the billing and stuff myself, and like trying to like haggle with insurance companies, and it was a lot of work, but it's worth it because it just makes my care that much more accessible.
That's amazing.
Yeah. Awesome.
Yeah.
As an entrepreneur, what advice can you give someone out there that's thinking about taking this big leap as well? Like, what are a couple of hurdles that you faced opening your own practice, and what advice could you give?
Yeah. So I got really good advice from another family doc I worked with, and he said you can never fail if you're betting on yourself.
Like Wayne Gretzky. You never make the shot if you don't take it.
Yeah.
Right.
Love that one.
Yeah.
Love that one.
Yeah. So it's like that was kind of like, well, okay, like I'll bet on myself, and
Yeah.
we'll see how and I don't regret it.
That's awesome.
So, but that always kind of stuck with it. I was like, okay, like, I guess I just have to bet on myself.
That's
and
right.
Yeah.
It's the best person to bet on.
Yeah.
Very cool.
So,
That's awesome.
but yeah.
That's exciting. Well, let's do some rapid fire questions. Are you ready for that?
Yeah.
Get to know Rainer a little bit
Sure.
deeper. Okay. So we know you got 4 kids.
Yes.
What's your favorite thing to do with your kids when you're not working?
When I'm not working, it depends upon the season.
Okay.
Wintertime, we love to go up skiing.
Awesome.
My son snowboards.
Okay.
Trying to keep up with him.
Do you guys have a favorite mountain?
Keystone.
Okay.
Yeah. It's I like the long runs. That's just less lift time.
Yeah, for sure.
When you're trying to wrangle like 3 young kids
Yes.
onto a lift, it's the less time you spend on the lift, the better.
That's cool.
So, but yeah, during the summer, we just hang out on the farm a lot. That is a busy time for us.
Yeah.
So we don't. Sometimes we get away from the farm a little bit, but we spend a lot of time there.
What's your favorite spot on the farm?
My favorite spot on the farm. There's a hammock in the front yard that I really like.
Oh, nice.
Yeah.
Can visitors go on that hammock?
Yeah.
Okay.
Yeah.
Okay.
But it's kind of I kind of have to sneak onto it, otherwise the kids see me getting on it and they all want to pile on.
Oh, for sure.
And make a swing. So,
Nice.
but yeah. So
That's awesome. What's one of your guys' favorite restaurants here in the Carbon Valley area?
really loved Peel. I was really sad when
Right.
that went away.
Yes,
But,
me too.
I've tried Lola's. That was really good.
Good.
We liked that. It's not really a restaurant, but I love Nico's.
Yeah.
That's my favorite newest addition.
Definitely.
So,
Definitely.
And we were talking about that before we got on
Yeah.
camera, how important it is to help the small businesses in the area.
Yeah.
Totally.
Yeah.
Right along that downtown court, not that there's not small businesses everywhere, but
Right. Well, Liz and I we had that conversation a while back that we really want to. I grew up in Frederick, moved away, then
did
moved
you
back.
really?
Yeah.
Okay, very
yeah.
cool.
And so I've loved seeing the small Frederick's downtown grow, and we both agree that if we want to see that happen, we have to support them.
That's right.
And we have to go.
You gotta plant some roots here.
We
Yeah.
kind of make a point of if we're going out to eat, we're eating local.
Nice.
Yeah.
That's great.
And you said Liz was from South Africa, and we'll meet her in a couple of weeks.
Yeah.
But did you meet Liz in South Africa, or and how did you convince her to come to Frederick?
So we actually met here in Colorado. So she was
Okay.
actually going to school down at RIMCAD, so
Okay.
Rocky Mountain College of Art and Design.
Okay.
Yeah, and you'll hear all about her story about
Yeah.
how she went from art school to nutrition, and then landed on the farm and just fell in love with growing flowers. But yeah, so we met when she was down in Denver, and when we fell in love, got married, and then when she got pregnant with our oldest. She really wanted to be. She grew up with being very close to family, and grandparents lived on her parents' farm in South Africa, and so she really wanted that for our kids. She wanted to be close, and so at the time we were living in North Denver, and I was like, well, we're close enough.
Yeah.
And she's like, no, I want them to be able to ride their bikes to the grandparents.
That's
and
very
so
cool.
that's when we started like looking.
That's
'cause
amazing.
At that time, majority of our family was still in South Africa, so she wanted some family.
Yeah,
close to
for
her.
sure.
So
Very cool.
that's when we moved back to Frederick in 2015, and then got the farm in 2018.
Awesome.
So, yeah,
That is amazing.
yeah.
That is amazing.
That's a great circle of life right there.
Yeah, that is. Well, thank you, Rainer, for coming to
Yeah,
visit us
thank
today.
you for having me.
We love getting to know your business and you, and we can't wait to meet Liz. But if you all are interested in functional and integrative medicine, reach out to Rainer.
Yeah,
He's a great one, and we're happy to have him in our community. So hope you enjoyed today's episode, and thank you again for tuning in. Can't wait to see you next time. Bye for now.
Bye.